Good afternoon and welcome to another Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live, and also available on TV3 in Connorsville. We appreciate them supporting and continuing to air this program. This is a program where the doctors are here to answer your questions, so those questions we are taking now on our Facebook page as well as through Twitter at WCTV Info. So please feel free to join the conversation. We will have a guest also coming up in just a few minutes, but first we're going to start by reintroducing, as we do every week, our doctors. I forget which way we go, so we'll go with Dr. Thomas Huth, who is Vice President of Medical Affairs for Reed Health. Sir, how are you?
Great today.
He's back with the Pocket Square this week after golfing last
time.
week, so no golf course time, huh?
No golfing this week.
Oh, too bad. And Dr. David Jetmore, he of the, I don't know, some very weird animal type things. And the motorbike, was this a good motorcycling day in?
No, it was kind of cool today.
Okay.
A little cool on the bike.
Bummer. Okay. Gentlemen, there was a spike in the numbers that I saw, I think, on confirmed cases. We were up to a number I had not seen, up to 99 lab confirmed cases or something like that in Wayne County. Why don't we start just by kind of talking about that and what you're seeing after Labor, maybe a little bit early, but what you've seen and heard after Labor Day?
Well, I think it's a little too soon, Eric, to assess what's the effect of Labor Day has been. If it's like the other holidays that preceded it, I anticipate that there'll be an increase in numbers. That 99 cases that you alluded to last week was an alarming number. I remember we used to get alarmed when we would have 10 cases in a week back in April. This week, so far since Sunday, we've had 54 cases, which is better, but still not a number that I feel comfortable with. And we've had a death. So we've had 13 deaths in our county. I think the number that concerns me the most is our positivity rate. It's gone up to 6.5%. And, it once was nestled at around 2 or 3%, then it edged its way up to 4.9%. Now we're at 6.5%. It's going in the wrong direction. And I think it's important for us to keep this in mind when we're out socially, gathering in large groups. I think it's important to continue social distancing and wearing masks. I think if you've got two people, Eric, that are wearing a mask and they're 6 feet apart, especially if they're outdoors, the chance of catching COVID approaches zero. And this is the basic defense we have. I've said this before, since we don't have a vaccine yet. We've got to keep this positivity rate down in order to keep these kids in school. If this positivity rate rises to unacceptable levels, we're going to have to pull these kids out of school, and I think that would be not a good thing.
Before I turn to Dr. Huth, just a quick question, and I think I may have asked this before, but we're a month almost into the school year. Things seem generally to be going pretty well, I think much better than many people anticipated. Thoughts on why that's the case?
Well, I think that's all due to the school people, the administrators, the kids, the parents, and the teachers. I think they've followed these protocols. I think it's always scary when you start something new, Eric, and we knew that there would be kids that would get coronavirus, but they've been in cohorts, so we know where those kids sat on the school bus, who the children were around when they were in school, and we were able to isolate these kids. They complete their isolation with virtual learning at home, and then they go back to school and continue onward. So I'm pleased with how this has proceeded. And I think as we go on, we'll get better at it.
Dr. Huth, 99 positive lab-confirmed cases. I know that's got to kind of raise some eyebrows over at Reed Health when you start thinking about that number.
And that was data that was through last Saturday. We count the week's endings on Saturdays. And when we met last time, Eric, we we didn't have that information because we weren't completely up to date with that. The week wasn't complete, but then Ryan is showing the graph now, and you can see that for the week ended September the 5th, there were 99 cases amongst Wayne County residents. And I think, some of that are some one-time things. There are a couple of small outbreaks that are being managed with public health measures in there that we think, that will be relatively easily containable. But that doesn't account for all of it. So I'm hoping that this will be a one-time peak and we'll have lower numbers after that. But I don't think we can know for sure what the future will bear. On the graph that we were just showing, it had this week through Wednesday night, but that did not include some data that we've gotten since then that Dr. Jetmore
Right, that number on the screen showed 38, so just mentioned 54.
We've got today's data, tomorrow's data to go into that yet, so where the week will end up is hard to say, but it's going to be another kind of a big week.
Okay. Well, we've added, 12 or 14 since yesterday. We'll probably add that same amount tomorrow, so we'll probably end up somewhere around 70 cases.
How is that impacting what you've seen at the hospital this last week or so? And one of the things that we had been talking about over the previous few weeks is that even though the number of cases were going up, maybe the virus had mutated a little bit. Some younger people were getting it, so we weren't seeing the hospitalizations, even with a number like 99. Is that still the case?
Well, REACH numbers have been higher than we would like, and our data shows that there've been a kind of at a plateau level that has been certainly increased significantly from about July the 1st. We still only have, I think this morning there were 2 COVID patients on ventilators. We're glad it's not higher, but don't like it that we have even 2, because those are real people suffering. We would like that to be 0. We obviously are concerned about the impact on the need for people to be hospitalized and some be so sick that they have to have ventilatory support when we have a lot of community spread in the county around us. And I would say our data maybe is a little bit disjoined from what the state data shows. The state dashboard has Wayne County at a relatively low level, alert level. But I think being a little bit closer to the ground, we're maybe a little bit more sensitive to the early changes. And I think that the statistics from last week and this week are going to probably drive this county's alert level up to the next step, I would imagine. I'm not sure that I know for sure how that's all calculated, but I would imagine it will drive it up.
I think the breakoff's at 5% to move up to the next stage, so at 6.5% we're bound to be upgraded.
Yeah, so we're concerned about that. We want to see we want to see those numbers be down, and I think Dr. Jetmore and I are on the same page that having a life, having an economy is not opposed. There's not an opposition to doing the right things with respect to protecting ourselves and others from COVID. We can have a life if we do the right things and protect ourselves, and it's not opposed. And so I think that's a false dichotomy. The way to have a normal life, relatively normal life, and normal economy, normal activities is to take the right precautions, reduce the transmission, lower the numbers, and we can go on.
Before we go to our guest, want to remind people that tomorrow there is a mask distribution event taking place at 4 locations around Wayne County. Dr. Jetmore just mentioned wearing a mask. You can get one. There is a box of masks, which is 50 in each box, being given out to every car that comes through. Cambridge City, there at Lincoln High School, Centerville, Crown Creek Boulevard, Fountain City at the Town Hall, Hagerstown New Testament Church. That's happening between 12 and 3. There is also a notation asking that you please not show up extra early. When they did this in Richmond this 5-6 weeks ago, they ended up having to start almost a half hour early because the lines were causing some real traffic issues. So they're going to start at noon. They've got plenty of masks, so don't show up much before noon. This is being sponsored by the Wayne County Commissioners, Wayne County Health Department. It is going to happen rain or shine, so we appreciate them doing that, and we will mention that once again before we leave. Normally, I introduce the guest, but I'm going to turn this over to Dr. Huth and let him do that.
Well, pleased to welcome Ryan Williams. I hope you're there, Ryan. Are you there? Are you able to say hi to us? Oh, we're not hearing you, Ryan. So we'll give our Ryan here a second to fix that.
Oh, we think we got it.
Okay. Are you there, Ryan?
Hello.
Perfect. We got you.
Good.
So this is my colleague at Reed Health, Ryan Williams. Ryan is leader in our emergency services area. And in particular, is responsible for the ambulance service that Reed runs. A lot of people aren't aware that a couple years ago now, Reed started an EMS service, and we provide EMS services to some of the, particularly the more rural parts of this county and a couple of the surrounding ones. But I thought it would be interesting to talk to Ryan about COVID and also a new thing that's going on with Reed EMS in providing service to Union County. But let's start with actually introducing you, Ryan. We put this together just yesterday and actually finalized it this morning, so I forgot to stop and ask for your exact title, so maybe you can give that to us right now.
Oh, that's fine. So I'm the director of EMS, Forensics and Trauma Services here at the hospital. So over the ambulance service, the Level 3 Trauma Center, and then what's known as the forensics part of it is more of our sexual assault program here for sexual assault victims here in the region.
Perfect. I mentioned that we've had this ambulance service for a year or two now. Tell us what was behind that, what started it, why did we even get into the EMS services area?
Sure. So I think for a long time that we, like other hospitals, experienced some transport issues of moving patients. Back in 2018, I believe, we were approached asking if there was any interest because at the time the bid process was out for Wayne County and nobody had at the time had placed a bid for the southwest portion of Wayne County, which covers the three entities of Cambridge City, Dublin, and Milton for that area. And so we quickly came together as a team and decided that yes, we would, that we didn't want those communities to go without an ambulance service. And so we put in a bid and were awarded that bid and have been serving since January 1 of 2019. So, and then a little bit later, so then, at February, March-ish of this past year, we started in 2019, we started general transports as well. So moving patients from our hospital to other hospitals for higher level care or back to nursing homes wherever the patient typically needs to go.
Yeah, so, when you're talking about providing emergency medicine services, sort of first responder outside the emergency department, I suppose by definition you have to be ready for the unexpected. But I don't think anybody was expecting COVID-19, and that probably was an interesting time in the EMS services for how to respond to that and be able to provide that service safely. What was that like back then, and what was the transition like for you and the EMS team, the ambulance service team, into how to do this in COVID-19?
Yeah, so it was interesting. So you're right. I mean, we're ready for the unexpected, just like we are here in the emergency department. But I don't think we were ready for the impact that the pandemic was going to have. So a lot of education. That's probably the biggest thing. Dr. Emily Kraft is our EMS medical director for the ambulance service, for the entire region. So there was lots of education, lots of information and kind of PPE protocols, so personal protective equipment protocols that we placed out there. The EMS crews are used to using personal protective equipment on a daily basis on every call. Routinely it's gloves, potentially goggles. To where we've morphed into they wear a mask as well now when they go out on calls. I think the interesting thing is that it really changed some of our response. We had to think outside of the box to try and protect our responders as best that we could. And so one of the things that we were able to do is work with our local 911 center here in Wayne County for the dispatchers to kind of provide a screening tool that most people maybe aren't aware unless they've called 911, that they're actually being screened over the phone as they dial 911 for either themselves or a loved one, they are being screened by the 911 dispatcher that then is passing that information along to our responders, so they can kind of have a heads up if there's any kind of potential increased risk, if you will, for a COVID exposure. And so then that's affected then the responders end, as far as we're used to having a plethora of help, mainly here in the city, but even outside of the city in the rural area, volunteer fire departments participate in care, that we're trying to limit the number of responders that are actually in patients' homes right now, just because of so we've decreased the exposure risk.
You mentioned PPE a couple of minutes ago, and I'm wondering if our EMS team, the Reed EMS team, or any of the other EMS services in the area have had trouble with PPE in the past or currently, or what's the PPE situation like?
So PPE status right now is really good. And when the pandemic first hit, I think it was a challenge for everyone. We were able to secure PPE. Our own service was able to secure PPE, obviously, through the hospital, which had quite a plethora of stock versus other entities as far as ambulance services. But they were able to think outside out of the box. They went to the local stores, tried to get what they could to secure PPE. Unfortunately, they were some were even using trash bags as gowns at the time when the pandemic first hit, just because that's one of the education points that we've learned from this, is that nobody was really prepared to that magnitude. Luckily we were able to secure, and we had, partners here in the community that, as you guys are well aware of, Primex and some of the others that came forward and was able to produce a lot of this PPE that made it available to not only us, but we secured enough to supply outside resources, outside EMS agencies, not just our own, with the proper PPE. So everybody's in pretty good PPE standing right now.
Good. So let me ask you about safe pathways with respect to EMS services. We've got the whole Safe Pathways program in the hospital footprint and in our outlying buildings footprints about how to move people safely through the system without coming into contact with people who might have COVID-19, so that we're able to provide services in a safe and effective manner. Is a similar thing happening with the EMS? What are you all doing from the EMS perspective to ensure that the ambulance trucks remain clean and that we can't cross-transmit pathogens between patients?
Sure. So we're following the same guidelines as far as isolation with regards to PPE. So if we pick up a patient here in the hospital to transport them somewhere, if they're suspected COVID or COVID positive, the patient as well as the crew remain in full isolation or full PPE protection until they're delivered at their destination. Once the patient has been, the care has been transferred over to the other hospital or what have you, the nursing home, then that truck actually goes out of service until they can clean the entire truck. We're very fortunate that we have a strong partnership with all of our EMS agencies around, one of them being Richmond Fire Department, that has supplied us with basically a contraption that they were able to do with their SCBAs, and you guys might not even be aware of this, but they have their air tanks that they use normally that's on their packs that they would go into a burning house with. They've actually were able to connect that to basically an air sprayer, like a paint sprayer, that we're able to put Virex in, and we can actually go into the back of the trucks in our full PPE with this pack on and actually spray the entire ambulance down to disinfect it, which has been super helpful. So usually the crews will take the truck out of service, come back to the hospital, we'll spray the truck down just to ensure that everything is safe for the next run.
Very cool. Well, before I transition to asking you about Union County, let me stop and see if Dr. Jetmore or Eric have any questions for you so far with respect to COVID-19.
No, I think you're on the right pathway here, Tom.
Okay.
Keep going.
Well, let me ask you right about Union County. I think I just heard a couple of days ago that we are going to be providing EMS services in Union County. What's behind that? What's the plan for that going forward?
Yes, so we were awarded last Friday the ambulance contract for Union County that will start January 1 of 2021. And so we're still we are meeting on this end to try and figure out exactly what that will look like. What that will provide for the community down there is a 24-hour 7 days a week coverage with paramedic level coverage, which I think that they were currently struggling with a little bit. Not to discredit the current provider down there, they doing their best as well. Everybody in EMS struggles a little bit with getting enough people involved to even be involved in EMS. But what we'll be able to provide is, the same quality of care that we provide in our other locations. High quality care with the best equipment around. We've got brand new equipment that we were able to provide in the Western Wayne area, as well as our transport agencies here. And then the same will be for Union County. We'll have the plan will be that the location would be located there at the neighborhood health clinic, which actually has an ambulance bay built into it from years ago when Fayette Regional had an ambulance housed down there. So we will occupy that space, which ultimately will bring us a little bit closer to town than the current provider. It'll be right at the edge of Liberty, which is the majority of where the call volume is at. So still a lot of details to come with that contract.
Right. We just found out about it. It's early days, more to come, but it's an exciting thing, I think, for that community. And at Reed, I know that we're grateful to be able to provide an additional service there and cement that relationship a little bit more and help out there.
Yeah, we're really excited about the opportunity to interact with the community. So that's what we're most excited about, is to participate in school events and things like that, and really become a partner with them down there.
Ryan, I'm curious, in all these runs you've taken, obviously carrying COVID patients, has any of the first responders, any of your people gotten infected?
On my particular team, I have only had one that was quarantined, and I currently have one that's quarantined, but neither one of them actually tested positive. They were placed off because of symptoms. We're still waiting on one result to come back, but for the most part, no. I have about 50 team members, and so for the most part, out of 2, that's not bad.
No, that's a fantastic record. But in retrospect, were you able to see some place where the system kind of broke down and the person may have been exposed to the virus?
As far as on the job, no. I would venture to say that it would be outside of the job, and I think I could speak for almost all ambulance agencies in the region, that if they have providers that have become symptomatic or test positive, more than likely it's outside of their work environment. It's probably in their personal life.
Well, Ryan, thanks for being with us today. You've been great. Appreciate you fitting us in at the last minute, and we'll talk to you soon.
Okay, great. Thanks for having me.
Thank you, Ryan.
Bye.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live, also available on TV3 in Connorsville. Interesting, the low number of EMS workers in the area who, obviously, in transporting a number of people, have not shown up positive. I guess that speaks a little bit more to the protective equipment that they're able to wear, the mask, things of that nature.
Exactly. It's and that's an important lesson for all of us. I mean, if you take these proper precautions, even though daily you're being exposed to coronavirus, you're not going to get infected.
And I think it's on the one hand, it's a testament to the effectiveness of the PPE. We know that it works. We now at the hospital have lots of experience with PPE in very sick patients, and we can't confidently come to find even one staff member who's gotten sick from a patient. Now, there have been people who have gotten sick, but in all cases, you can do the tracing and follow the tracing, and we can see that most of those cases have very clear contacts outside the hospital. And I think it goes to the importance of people can do all the right things when they're face-to-face with patients, and that's good, but then there's the impact of what we do behind the scenes when we're not patient-facing. We have to continue our precautions in order that if someone comes in infected, they're not spreading to other staff. And then everybody has to be safe outside of work in the community to not get infected in the first place. And that's just the familiar story. It's true at the extended care facilities. It's always somebody kind of bringing it in. It's been true at the hospital. We've had little pockets of outbreaks here and there, and in all cases we can find that it's from bringing it in, and it's the same thing with the EMS services.
You know, one of the things that makes me reflect on, Tom, is when back in March we were talking about this is going to continue until we have a vaccine. But if you have a trade-off between getting a vaccine that is going to be, say it's an excellent vaccine, it's going to be 70% effective, and keeping 6 feet away from people and wearing a mask, which is 100% effective, basically, you're going to be loath to abandon that, even though we have a vaccine. So I think our thinking, or certainly mine, is starting to change. That this isn't going to be a radically different change in our behavior at the beginning, where everybody gets a vaccine and we all go out and party, which I had hoped for personally.
Yeah, I mean, I think that's what, before we kind of knew very much about any information about, say, the dynamics of antibody levels, about the effectiveness of any potential vaccine. I think we had kind of hoped that, oh, maybe there'll be this, silver bullet that'll just take care of it. And that's a normal, natural human tendency. But I think as the reality is beginning to come about, we can see that we're going to struggle with a number of things. Maybe the antibody levels will wane. Maybe the virus will mutate so that the vaccine is not, as well targeted as at the end of the day as we might like, and it'll have to be adjusted over time and re-administered. Maybe we'll have trouble getting people to take it, and that's what's, surveys are starting to show, that a lot of people are expressing hesitation about taking a COVID-19 vaccine. I saw one study that said only 20-some% of people right now are saying that they definitely will take it. I think that can increase with education, and as people get experience with it, that'll probably be higher than that. But with influenza, you would expect that by now, with so much experience with influenza in communities and vaccinations going on for years and years, that more people would take it. But I think we struggle in most years to get 50% of eligible people to take the influenza vaccine. And, so we'll have a lot of work to do to even get people vaccinated. And I think when you add all that together, it means that we're still going to have COVID in the community. And at some level, we'll have to continue with personal protection.
We're going to go to some of the questions, and then I've got one, if it's not thrown in here, just from watching a football game last night, something I want to ask you all. But let's go to the first question. Can you explain what the difference in the 7-day positivity rate on the state dashboard are? There is a 4 to 5% difference every day.
Well, let me take a quick stab, and then while Dr. Jetmore can think about it and come up with the best sounding answer. When you go first, it comes out a little bit.
So you're offering me a chance for the rebound here.
Exactly.
I'm going to
let you go up for the rebound, Dr. Jetmore.
Okay, the pressure's on.
So the 7-day positivity, that's just a simple average. And so if you have one day that there's a lot of reports, that'll deflect things up or down dramatically. And so, they're doing simple moving averages, which are much more liable mathematically to a lot of noise in the data over time. And there are statistical ways to smooth those kinds of curves out, but they're not doing that with these numbers. And so, we can have very low transmission in a few cases that come along over a number of days, and then all of a sudden there's a big bolus, like we had last Friday when there were 32 cases in Wayne County reported all in one slug. And so those kinds of experiences will cause dramatic changes in the 7-day positivity rate.
Well, I think that's an excellent answer. I think it's a combination between in the case of those 32 cases, a local outbreak that distorts the figures, and also the fact that the way this data is gathered is imperfect. It's not, as each case occurs, it suddenly is added into the data. It's collected in clumps, and there's always an artifact on Monday reporting, because there's not somebody to send the data in on Sunday and maybe Saturday evening. So you see these these up and down numbers, which don't seem to be explained from a clinical standpoint. So it's just the mechanism of gathering the data and the occasional outbreak that causes these numbers to be distorted. But you can get the bigger the picture you take, the more you look at it, the more accurate your positivity rate's going to be. You know, the positivity rate for Wayne County today is 6.5. It's been reported as low as 3.5. We can assume from that it's not 0 and it's not 10. You know, it's somewhere in there. We're never going to know that number exactly, even though whenever I see a number that has a decimal point, you know, it seems like that's incredibly accurate. But these are the best we can do with the data we have.
I think, wouldn't you agree that probably what I'm looking for, in addition to what the number is on any particular day, it's how it's changing over time.
Exactly.
So if that's 6.5% that we've got right now, if that stays at 6.5% or goes higher, and there seems to be a trend, that means more than if it was, for a couple of days it was 6.5% and then settled back into the 4% range we've been at.
That's exactly. We could be looking at 6.5% and say, whoa, this is great. It used to be 10, and before that it was 12. But, you know, as I said earlier, it was 3.5, then it was 4.9, and now it's 6.5. So it's going in the wrong direction. But you're exactly right, Tom. It's the trending of the data that gets your attention and allows you to make conclusions.
I think one of the things people can also look at is when data is reported, because that is one of the things that you do see on the state website. Deaths, positivity, any of that, even positive cases, sometimes you look at that and their starting date is 3 weeks prior. So things that were reported during a 3-week period is what they're putting into that number. So that always makes things look a little bit different also.
True.
Next question. Is a school bus driver who was working up until a positive test considered to be a close contact for those on their bus?
Well, I think it depends on probably where the child sat. I mean, if the child or the school bus driver is a close contact with the kids on the bus who are within 6 feet of him for 15 minutes or longer. If you're a child that sat in the back of the bus, even though you walked past the bus driver, you're not a close contact. The same way with the bus driver, if he sat with the other bus drivers, waiting to pick the children or to go out on the bus run, then those people would be close contacts.
I mean, I think I'm trying to imagine myself to be a parent of a child on a bus that the bus driver turns out to be positive. How worried should I be about that? Well, there may be some steps that from a public health perspective, you're going to look at the spacing and you're going to identify close contacts and take, standard protocol tests or standard protocol steps based on that. But from a practical standpoint, as you say, if my child normally sits midway or back, and all he's doing is walking past the school bus driver, even if neither one were masked, I wouldn't worry so much about that. But here I'm sure we have all the bus drivers wearing masks while they're driving. We have the children wearing masks when they get on the bus. And so that even lowers the chance that there can be a significant viral load be transmitted as a viral dose to a child. So the mere fact of being within a couple of feet for a second or two is not going to bother me. I would not worry about that particularly, even though, the school corporation and the health department need to take some steps based on the driver's positivity.
Probably the ultimate person that'll take the controlling step is the child's mother. I know there are, there's a lot of mothers that would take would isolate their kid or keep them out of school for a couple weeks, and so that kind of trumps the health department. But I think from a public health standpoint, what I expressed and you expressed probably makes the most from a scientific standpoint.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21. We're taking your questions on our Facebook page, as well as on Twitter at WCTV Info. Next question up. Disinfecting products are hard to find. Still, yes, they are. Are there any homemade cleaners, such as vinegar, which may be effective against the virus?
It seems like the go-to product that people have mentioned is bleach. A mixture of 0.5% bleach and 0.5% water is pretty effective at killing the virus. I would like to add to that when this all began, all of us were obsessed with hand washing and the idea that we might touch something and pick this virus up and transmit it to our eyes and thereby to our nose. And with the caveat that we shouldn't be cavalier about what we touch or hand washing, I would guess, and this is a guess, that probably 98 to 99% of these cases are transmitted by droplets laden with virus passing from an infected person and being inhaled by a non-infected person, and not through contamination from the virus. So I think it's important to practice hand hygiene and keep surfaces clean. I would be comfortable if I ran out of whatever the Purell or whatever the hand sanitizer du jour is in terms of surfaces using bleach. And as far as my hands, I feel pretty comfortable just using ordinary hand soap that I would buy at a grocery store. What are your thoughts, Tom?
Yeah, absolutely. I think, well, first of all, specific to the question of how to make your own cleanser, I would just use soap and water on surfaces that I can and not worry about juicing it up too much with even Clorox or anything else. But I have seen, recipes out there for, chlorine-containing solutions. I've seen them with hydrogen peroxide. I've seen them with alcohol. Those are all products that have their advantages and disadvantages in different ways. But to me, knowing that knowing that contact spread is probably not as important a route of transmission as respiratory spread, I would be comfortable just cleaning. I think it's a good idea to clean surfaces, but I would just use whatever product is to hand, even just my making up some soapy water to do, because we know that soap very effectively kills the virus, honestly, probably as well as alcohol does, honestly, as a practical matter. But this is a good opportunity to bring up something I've been thinking about with respect to contact spread. We've been kind of downplaying the role of contact spread, and a lot of people kind of think in black and white terms, so does that mean we don't need to worry about sanitizing at all? If I'm saying this is really a respiratory spread thing, do I need to worry at all about sanitizing my hands or sanitizing surfaces? I don't think we should take a black and white approach to this. It's not an all or nothing thing. And so sanitization is still important. That is just a normal part of, infection control, and we should do that. But the way I look at it is, if I can't do anything else, I'm going to distance and wear a mask.
Okay. Mask. Watching football last night, NFL is back. I honestly didn't think I would see professional football this fall, but they got on. Andy Reid, coach of the Chiefs, was wearing a shield. Talk about where you would see or when you would expect someone to be in a shield as opposed to just a mask. We don't want to see people running out and doing that, and they've had them in a couple of different ways where people can buy them with baseball caps and all kinds of other things already attached. What is the protocol for needing that?
Well, a shield is much less effective than a mask, and that's intuitive. I mean, your breath is escaping around the edge of the mask and around the bottom of the mask, and to some extent out the top of the mask. So you've got this what you're sending out that's infectious are these little water droplets that have virus in them. And you could see the bottom of his mask was fogged up because it was full of water droplets. Well, a mask traps that. And we've had comments on the show about people wearing a mask and working in the summer, their mask gets soaked because of, not from sweat, but from the moisture you're breathing out. Is a shield better than nothing? Yes, but it's not as good as wearing a mask. But we've talked about using this in special occasions. Suppose you were a speech pathologist teaching a child with a stutter. You couldn't do that with a mask on, so you would, in that circumstance, wear a shield. And if you're coaching an NFL team, Eric, it's probably advantageous to have the shield rather than the mask.
So they can actually see the words besides just hear them.
Well, there's that, and I suppose it's possible. And I haven't seen any explanation for why Andy Reid was wearing a shield as opposed to a mask. Maybe it's some personal thing about he just doesn't feel like he can tolerate the mask. And it's probably partly he wants to be able to, the players be able to see his lips because there's noise and it's just feels he can't express himself. I'm going to guess it's stuff like that. But there also could be another aspect to it that might be an issue down on the field, and that's players are sweaty and they're hollering things, and the one situation where a shield is definitely effective over a mask is if there is actual like splashing or gross droplet emission.
That's a good point.
And maybe that's what he's thinking. I don't know. So I'm not going to judge Andy Reid for that. But when it comes to should I go to the grocery store wearing a shield instead of a mask, or the problem there is that we've already know that mask products that don't contain the emissions more closely to the face are relatively less effective. So, for example, we have basically banned from use at the hospital masks that have vents, because those just simply vent straight on. They may, the vents close when you're inspiring, but the whole point of wearing a mask is to protect others, really, and the vent totally circumvents that. So. And the thing with the shield is that, anything that you emit or when you breathe out, it all just flows out freely around the sides or over the top. And so that's why masks or vents, or I should say the shields are much less effective. But they have their place for the splashes in particular. And so I think we need to make some distinctions about the uses in the situations. A face shield is certainly applicable in certain situations, and it's better than nothing if you truly can't wear a mask, but it really doesn't replace a mask for all situations.
Not making fun of Andy Reid. I
No.
was just curious.
Andy beat the spread. So there's that.
I didn't see the end of it, so I'm glad he did. Doesn't help me at all. Next question up, Ryan. Can the COVID-19 virus spread through sewage systems and or treated drinking water?
Well, Dave might have a little bit more insight to that, kind of being the public health guru. But here's my take on it. Water is treated with chlorine solution. Our drinking water is chlorinated. I think there's pretty good confidence that does effectively kill virtually all viruses, including the COVID-19 virus. And so I personally have no concern about drinking water. It's so treated. I mean, because it's not just the chlorination. There's all kinds of filtration and treatment steps that go into that. So don't worry about the drinking water. Now, sewage is a slightly different topic because we do know that there is a way to actually kind of predict when you might be on the cusp of having an outbreak in the community. A couple different studies have shown that if you monitor the sewage systems and you begin to detect higher levels of, you begin to detect the virus in samples from sewage systems, that can predate a symptomatic outbreak of illness in a community. And because of that, I think it was 2 weeks ago, or maybe it was just last week, the Ohio governor announced that they are actually setting up sewage monitoring systems around the state of Ohio. I'm not aware that that's being done in Indiana, but they are doing it in Ohio in order to have kind of an early warning system on outbreaks. That's a different thing from the question I was asked, can sewage systems transmit the disease? I don't know about that. That's not why they're monitoring the sewage systems. It's really more for an early warning system. But I can imagine people would worry that means sewage systems can transmit it. But I would say this, that doesn't mean you should be, even if it's hard to get COVID-19 from a sewage system, still be fearful of sewage systems because there's lots of other pathogens in sewage that we don't want to be exposed to. Now, Dr. Jetmore, tell us the truth.
So
on
your
that.
take home from that is to avoid sewage systems.
Yeah, I guess that
Well, I have
that
to.
is the five-word summarization of what I just said.
Yeah, I think people have, I think you're right, Tom. People have heard about these sewage systems and worry about catching the virus from it, but basically people are monitoring these sewage system for the virus to predict outbreaks. But we spend a lot of time, communities and even people that have septic systems in rural areas, isolating ourselves from sewage systems because that's the source of a myriad of disease and of bacteria. So it's not something I would worry about. That's not changed since the COVID has begun. So.
We've got about 10 minutes left to go. We want to get to some more of your numbers in a minute, but we're going to give you a do-over. There was a question that we got earlier.
Did we get it wrong?
That you answered, but not quite to the satisfaction. So we're giving you another shot at this. So let's bring this one in. Regarding the state 7-day positivity rate on the state dashboard, what is the difference between the 6.5% positivity rate, all tests, and the unique test rate at 10.5%, which is the correct rate?
Okay, so in Indiana, they're in the last couple of weeks they've been making a distinction between people who are first-time test takers and those who've been getting tested repeatedly. I would fall into that latter category because I get tested every week, for some other work that I do with the vulnerable elderly population. And so I fall into that latter category. And so that would be all test takers. And then there's the people who this is basically their first time taking a test. And so I'm going to guess, I haven't really paid attention to it in the last couple of days, so I'm not sure which way the numbers run. So forgive me if I get it wrong. But I'm going to guess the 6.5% applies to all test takers, and that the 10.5% might be the first time or unique test takers, because those are people who are more likely to be getting tested for a specific reason, like they're a contact or like they're having symptoms. So hopefully I've gotten the numbers in the correct order, but I think that's the difference.
I think those numbers are right. I mean, the first-time takers are more likely to be people who are symptomatic or have a specific reason for taking it, more specific than you are. Is kind of a prophylactic way of ensuring that you're healthy when you go see elderly patients. But I don't think that question was worded quite that way before in defense.
I think it was worded a little bit differly, but that's why she came back around.
Well, I'm glad she did.
With trying to get an answer, and that's good, and I'm glad they did that. That's why you all are here. That's why we're able to do this live, so that we can kind of clear some things up. We are under 10 minutes, probably under 9 minutes probably by now, so we want to bring in some of the rest of the numbers that you had. We looked very early on at the Wayne County Weekly New Lab positive cases. So if Ryan wants to bring up the second slide, and you can go through some of those by age groupings. And I noticed that you were showing an upward trend in some of the age groupings.
Yes. Now I wonder, Ryan, why it's not showing my arrows, but I did add some arrows to the 10 to 19 and 20 to 29 age groups here, just to show that over time, as I pointed out.
And 40 to 49, by the way, and I'm
Yeah,
holding
as
that.
I pointed out many times, we're seeing increases in the younger age groups. So there is a change to younger age groups. But what's really important is the 1, 2, 3, 4, fifth set over the 40 to 49 age group. We're seeing an increase there. And that wasn't as noticeable before. And it's basically a theory at this point, but it harmonizes with what the state has been saying they're seeing in their data, which is that as kids have gone back to school, they're seeing more close contact positives amongst children's parents and other household adults. And so I'm going to theorize that here in our Wayne County data, where we're in the latest period seeing a noticeable bump in the 40 to 49 age group, it may be because of kids going back to school, and we're seeing more cases amongst children and their parents because of the contact. And that appears to be a normal phenomenon in as much as it's being seen around the state, and I'm sure that there are other places around the country where the same thing is happening.
But that was one of the things that you all were discussing, including Dr. Jetmore, that it wasn't so much maybe the kids that were the concern, it was their contact with teachers who tend to be older, their contact with older members in their households. We have multi-generational households living together, and having that concern of that coming home. That was part of the conversation very early on when we were talking about kids going back to school.
Right.
Next slide up would be the daily hospital average.
This is the average daily hospital volumes at Reed. We can see this for the entirety of the pandemic, and of course the latest period is the far right. And we could see that dip down to about the 1st of July, and then we've been up. And there's really no surprise here. We're in a leveled off period, basically, with some wiggling up and down. I think today specifically there were 27 or 8 patients in isolation, about 13 known positives, and 2 patients on ventilators this morning. Okay. So it's pretty much status quo. I wish it would go down from here.
We've got about 6 minutes left. We're going to try to get one more question in, I think, before we bail out of here. So let's see what we got. Can ultraviolet light disinfect surfaces and objects?
I love this question. We didn't get to it last week, and I'm glad we were able to this week. The answer is yes. That actually is an age-old thing that has been done for many years. I can remember, and you could probably remember, Dr. Jetmore, at the old Reed Hospital, where you went in through the loading dock to get to the doctor's area. They had one of these wall-mounted UV light things. Do you remember that?
Yeah.
And we don't do that these days, but there are systems for sterilizing, ventilation system using UV light and so forth. You can find those. But yes, it can. In fact, we use an ultraviolet light disinfection system at the hospital for OR rooms, for rooms that other hospital rooms that have had COVID patients. It's actually like a little robot that uses high-intensity UVC light to basically quickly sterilize an entire room all at once. We have a couple of those robots that we use at Reed. Now, the question is, how practical could that be at home? And I'm not sure about that. You got to get the right wavelengths, and this system that we use at the hospital is very high intensity. People can't be in the room with it because it can actually burn you or can harm your eyes and so forth. So people have to be out of the room. So I'm not sure how practical that is for people to use at home, but I think I can remember seeing that you can buy little boxes to put your your cell phone in and keys in and get them sterilized. I haven't seen those lately. I don't know if they're still doing that, but whether that really works or not, I don't know.
I was reflecting back on conversations we had back in March about, won't it be great when the summer comes, because there'll be a lot of ultraviolet light and humidity, and the virus will disappear or be really suppressed. And indeed, that happens with other viruses. That's why we have a flu season. That's why the flu season is in the winter. But this particular virus, which we continue to learn about, doesn't seem to be affected by ultraviolet light and humidity like other coronaviruses we've dealt with in the past, which is a little disheartening.
Okay. Gentlemen, we are going to wrap this up here. We probably throw another question in front of you, but then we'd be racing to get out, and that would look bad, so we'll avoid that this week. Dr. David Jetmore, Wayne County Health Officer, thank you very much for your time. Dr. Thomas Huth, Vice President, Medical Affairs, Reed Health, and WHIO, 5 p.m. Wednesday evenings.
Correct.
Also some advice there, and you can also find him sometimes just on Twitter and LinkedIn.
That's right.
He's providing information all over the place, and we thank you both for it, and we thank you for being here. I want to remind you, there is a mask distribution event. We've talked about masks, the effectiveness. Try to get one if you can. 1 box of masks, that's 50 masks being given out tomorrow between noon and 3. Cambridge City, Centerville, Hagerstown, and Fountain City are the locations. Again, that's between 12 and 3, and they do ask that you not show up well ahead of time because they're really trying to avoid traffic situations, which they had with previously. Tomorrow also is Super Shot Saturday at the Wayne County Health Department. Back to school immunizations and other shots for adults and youth. That's taking place between 10 and 2 tomorrow. Most insurance plans are accepted. 100 South 5th Street is the location of the Wayne County Health Department. You can give them a call at 973-9245 if you have questions about that. Don't forget that if you need COVID testing, the community testing site is still available at the old Elder Bierman site at 601 East Main Street in Richmond. Again, you can call the health department if you are in need of some information on that. Something else that is taking place tomorrow, I want to remind you about, voter registration rally is going to be taking place. This is the third of 3 that have taken place at various places around the community. This one is going to be at Jack Elstro Plaza between 2 and 6 p.m. So you have time to go get a mask, go get your vaccinations, and still make the voter registration location between 2 and 6 at Jack Elstro Plaza. That is being hosted by the local NAACP. If you're looking for something fun to do with your kids tomorrow, Birth to 5 is providing a Color a Child's World roll and read. That's tomorrow beginning at 10 a.m. At the First Tee area at Glen Miller Park. Also something that you can put on your calendar, the 2020 Walk to Ends Alzheimer's is happening next Saturday. Trying to socially distance this. This is going to be a kind of walk where you are type of event. So you can register for that, act.alz.org/Richmond. Thank you very much for watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11. We'll be back again next Friday at 2 p.m. As always, I wish you well. Have yourself a great weekend.